Hi, I'm Dr. Dietrich. I practice at the Freighter in the Medical College of Wisconsin. I grew up in the woods of Vermont, but came out to Wisconsin for Marquette for undergrad and actually stayed here for all of my training. So I've been here for 14 years and I'm an adopted Wisconsinite. I trained at the Medical College of Wisconsin for residency, and then I stayed here for a fellowship to do men's health and infertility. So I do about 50% of men's health, and I focus mainly on erectile dysfunction and Peyronie's disease. So I work with guys of all ages with their erectile dysfunction, and I specialize in surgical procedures for erectile dysfunction, including Peyronie's disease fixes and penile implants. Urology offers a pretty unique experience as a provider for the patients. It's a relatively intimate setting in terms of the diseases that we diagnose and treat. Patients are coming to us with a little bit of their tail between their legs. It's a vulnerable place to be with the diagnoses and areas that we're working on. And it just offers an environment where you can connect with the patient, make them feel comfortable in a vulnerable environment, and offer treatments that are relatively quick and life-changing. It's a big quality of life issue for patients who come to me with their men's health and fertility issues, and specifically for men's health, men are often vulnerable and need a provider that they can connect with. My areas of interest, specifically in the men's health realm, are around Peyronie's disease and erectile dysfunction. I look to treat the patient from start to finish with their goals in mind. I'm not here to push any treatment options on a patient when they come in. We really have options starting with medications all the way up to surgical implants. And patients can choose which route they want to go from the get-go. They don't have to start with something and fail that before they go on to the next. So I really want to sit down with the patients and have a discussion about their goals. And so my interests in the treatment of erectile dysfunction specifically are to get you to the end goal that you want with the option that fits you best. Men's health, again, is a pretty vulnerable place for men to be. They come in with a problem that often is embarrassing, life-altering in terms of quality of life, and often is undertreated by primary care physicians. And as a urologist, I have a little bit more in my arsenal to treat men with. And it offers a way for me to get to know my patients and travel with them through their treatment of different options and offerings so that they can feel comfortable and get to the point that they want to get to for their health. I really come into the visit with you with an open mind. I want to have a discussion in terms of your goals, what you see yourself doing in 4 or 5 years, how you want to get there, and work with you to try and find the treatment plan that best fits that goal. Again, I'm not going to push any treatments on you. I'm not here to sell you anything. I really want to figure out what is best for you, and sometimes that's ending with just medication treatment, or sometimes it's going as far as doing a surgery for a penile implant. But we can at least have that discussion and work with you to try and fit something into what your outlook is for your treatment.